Hi, and welcome to MLive's Roundtable, a virtual edition here with Governor Whitmer, as well as Dr. Joneigh Khaldun, who you've seen at some recent press conferences, and Chief Operating Officer Trish Foster. So we're here to talk about vaccines, which are, of course, the subject on a lot of people's minds today and every day as our state continues to battle the coronavirus crisis. And Governor Whitmer, I was hoping you could start us off with just sort of where we are here today on January 13th in terms of the vaccine here in Michigan.
Sure, Emily, and thank you for hosting this, and thank you to MLive for hosting, and thank all of you for tuning in this evening. And we've been fighting the COVID-19 pandemic for 10 months now, and I wanted to take a moment to update you on where we are. Michigan has earned and maintained our status as a nationwide leader in the fight against COVID. We're outpacing our Midwestern neighbors and states across the country when it comes to protecting one another from this virus. We're currently in the second phase of our vaccine distribution plan. As of this past Monday, people who are over the age of 65, child care and pre-K to 12, grade 12 teachers and staff, first responders, jail and prison workers, and workers in other congregate settings like homeless shelters are eligible to receive the vaccine. Now, we were originally told that Michigan would receive over 300,000 vaccines per week. And so we planned accordingly. And yet, when it was time to receive the shipments, we've been seeing consistent reductions in the number of vaccines coming in. Significantly so, in that 60,000 vaccines is what we are getting per week at the moment. Our original plan was to vaccinate nearly 50,000 people per day, but that's just simply impossible with the number of vaccines that we are receiving each week. There's just not enough vaccine to go around yet. But thankfully, we see demand increasing, and we see light at the end of the tunnel with a commitment from the incoming administration in DC to ramp up getting vaccines into states. I recently led a team of 9 governors requesting that the Trump administration release millions of doses of the vaccine, the Pfizer vaccine, that are currently being held back and in freezer farms right here in Portage, Michigan. They've granted our request, and I've urged the Trump administration to also give us permission to purchase another 100,000 doses of the vaccine so that we can speed up distribution and put more shots in arms. Michigan and states across the country are ready to take action and to step up. But I urge you all to stay patient. I guarantee we will get a vaccine to every person in the state who wants one. It will just take more time than any of us thinks is reasonable, but we're going to push through and we're going to get there. Today, my administration announced that indoor group fitness and exercise classes can resume with masks, including K-12 extracurricular activities involving the exhalation that we're also concerned about, and indoor non-contact sports may resume as well. So this doesn't mean that we can let our guard down. Just because we're leading, just because we're in a stronger position, this is all very precarious. And so it's more important than ever that we continue to wear masks, practice safe social distancing, and avoid indoor gatherings where the virus spreads easily from person to person. I'm really glad you're here tonight, and I'm looking forward to your questions, and I'm glad to be with our Chief Medical Executive, Dr. Joneigh Khaldun, and our Chief Operations Officer, Trish Foster.
Great. Well, thanks for the summary, Governor. And this is Justin Hicks. I'm a reporter with MLive covering public health. And we're going to bring in Dr. Khaldun and Chief Operations Officer Trish Foster to help answer some of the questions as we go through tonight. And the first question is probably going to be best suited for you, Trish. So there appears to be this disconnect between what we're seeing with the data published on the health department's dashboard for vaccine distribution and what we're hearing from state officials in terms of the amount of vaccines that have been administered versus those that have been distributed and received from the federal government. So if you look at the dashboard, it suggests that Michigan has had about 40% of doses go into arms so far out of how many we've received from the CDC. Can you kind of explain why that's the case when we're hearing from state officials that we've gone through our stock and we need more?
Sure, absolutely. So I mentioned this at our press conference today, and I think we may have a slide. The slide is outdated slightly, of course, because all of the numbers get updated after 3 p.m. So please bear with us. I'm not sure if you can put that up or not, but what we have here is multiple data feeds from state systems as well as federal systems. So if you look at it would be my far right, you've got the total vaccines. This was again before 3 p.m. today, and you see the orange indicates those that are unadministered but scheduled, meaning they've been scheduled to be vaccinated. And then the blue means administered, meaning that's actually a shot in an arm. So first, I want to explain that, it takes anywhere between 18 and 25 minutes for every person to get vaccinated. And of the controllable vaccines that we have, it is going to take our time to update that within 24 hours. So every single provider that we have has 24 hours to update their data. Again, if you look at the 831,150, that's the total that you see on the dashboard. That looks like we haven't gotten that many doses in the arms, 296,000. What that orange represents, however, those are shots that are scheduled out. In the best of times, vaccinating 5.4 million people, it would take a long time to do. The middle bar graph there explains our long-term care federal program. We aligned with the federal government so that they could vaccinate our long-term care and skilled nursing residents by using their federal partners, Walgreens and CVS. What you'll notice there is although that the shots are scheduled out in that orange, the blue, the ones that are actually getting the arms, aren't happening as quickly as we would like. So that's why we've asked for additional assistance there to allow more federal partners and pharmacies right here in Michigan to get added to that pool so that our long-term care and our skilled nursing residents can get shots in arms faster. If you look at the next column, it's called Michigan Controlled. That is the amount of allocations that are actually coming into the state of Michigan that we distribute out. That's what we control. All of the vaccines that we get are distributed. Of that, over 200,000 have been put in arms, and the other 329,000 are scheduled to be put in arms. And so what we've indicated is that, with getting 60,000 shots per week, and we've increased our shots per rate in the arms from 12 to 33,000 in the last week, we're going to be running out of supply in 7 to 9 days. And so that's why Governor Whitmer took action, as she often does, and we can count on her to do, to try to get more vaccines in the state by asking the federal government to release held back doses and asking the federal government to allow us to purchase more vaccines from Pfizer.
And so to clarify that, every one of those doses that we have received in Michigan so far has either gone into an arm or has been paired up with an eligible resident who is scheduled to get that shot in the coming days. Is that right?
That is correct. And what we're trying to do is not have, and I have these hospital calls and healthcare calls every morning at 7:30, and they're panicked because they don't want to cancel appointments that are booked 2 weeks out. We're trying to do things orderly here in this state, and that requires, eliminating chaos means you have to have a scheduled appointment, but the appointment only makes sense if you have a vaccine to pair with that appointment.
Great. Dr. Khaldun, over at the health department, the dashboard's updated daily. Because we see the numbers of distributed vaccines and administered, and they do seem they look separate just looking at it from a glance. Is there any changes that you plan to make to the reporting aspect in order to kind of provide more clarity to folks who are just checking the dashboard on a daily basis?
So, throughout this entire pandemic, we have learned a lot. We continue to receive questions from people about what makes the most sense as far as what they want to see on the dashboard. So we will continue to make improvements. For example, we now have our long-term care program. So a part of that allocation that Trish talked about was for our long-term care program. If you look at our website now, as of 2 days ago, we're now telling you that we have clinics who's going to be administering the vaccines for those clinics and how many have been administered so far. So we will continue to make those updates. Another example, we now have doses. You can look at first doses and second doses on the website as opposed to just the first one. So we will continue to make those updates to the dashboard, and we do want it to be as easy to read and accessible to everyone as possible.
Governor, I have a question for you from Sarah on Twitter. And if people have their own questions, please be sure to comment. We're trying to get to as many of those as possible in the next 30-ish minutes here. But Governor, Sarah would like to know, what are the long-term plans to protect our kids from COVID-19? Because kids can't get vaccinated, it's unclear to me when and how we get back to normal for them. While serious complications are rare in kids, they do exist and are scary, at least to this mama.
To all mamas, I would say, and whether your child is very young or starting to get toward the age where they could get a vaccine, I think we're all concerned because we're moms and because we know that in vaccine trials, they are typically not using children in those trials, and so there's a lot of unknowns. What we do know about this virus, though, is that the incredible vaccine creation that has happened is really a marvel of science and has had this inclusive, incredibly detailed testing that's gone along with it. With regard to our children, though, you just can't test vaccines on kids. And so we're fortunate that this is a virus that that isn't uniquely vulnerable for children, unlike the 1918 flu pandemic, that really the largest category of people that was vulnerable were children. We're fortunate that that's not the case here. But kids can get COVID, and kids can transmit COVID, and kids can also have COVID and long-term issues afterward. And that's the novel nature of this virus. We've learned an incredible amount about COVID-19 since it first came into the state. We have much more to learn, but we are going to follow the science and listen to the experts and make sure that as we make recommendations and protocols for our youngest citizens, that is always informed by the best science. Dr. J, what do you want to add? Because I know I'm not the health expert, you are. What else might you want to share so that we can give these parents some assurances?
No, I absolutely, again, as a mother of 3 children myself, I'm absolutely concerned about them getting COVID or spreading it to others. But I think really the most important thing we can do is decrease the spread, limit the spread of the virus as much as possible. It's really that simple. If there's less virus in the community, it's less likely that our most vulnerable, from our elderly, will get it, but it's also less likely that our kids will get it and spread it. I also think it's important, and I've gone through this myself with my youngest child, making sure they know how to wear a mask properly, making sure they're getting used to it. I mean, really, very early in the pandemic, I would have them walk around and just get used to it so that it wasn't as big of a deal when we went out into public. And so they're very comfortable wearing masks now. So I think we have to continue to just make sure we're limiting the spread of the virus as much as possible.
Earlier this week, the second priority group, 1B, was opened up. The eligibility was expanded for those folks. What went into the decision behind expanding the pool before getting through all healthcare workers in priority group 1A?
Should I start?
Yeah,
Governor? Okay. I think we can all probably answer it, but I will say from the beginning, actually, the CDC and the the ACIP, the governing the body that provides scientific recommendations to the CDC, they did say that these phases would run in parallel. So we always knew that one phase 1A, would not be completely 100% done before we would move into the next phase. What we were identifying across the state is that there were some areas where they'd gone through their 1A populations, and there were some people who were hesitant, or they'd gone through a sufficient amount and they were waiting. So we didn't want any vaccines waiting and sitting on shelves. And so we decided to move forward as a state, understanding, of course, that not everyone in 1B would have vaccine available to them immediately.
I think I'll just add something that, we know that this is going to be bumpy, right? We know that when you move fast, there's lots of adjustment that has to be made. But we also know that we've heard directly from the HHS at the national level that they will be prioritizing states that are running out of vaccines. And that's why we don't want to have vaccines sitting in freezers. I know that some people have pointed to and said, look, our freezers are empty. You know what? If there's a freezer that's full, that's a bad sign that there's not a plan and that these are not vaccines that are getting in arms. And so collapsing these categories to some extent as we did was important to maximize how many people were able to get the vaccine as quickly as possible, especially as we prepare for additional vaccines to come into Michigan. And I would add that we made that change, and then subsequently, a few days later, the CDC made the same recommendation, which was the change that we made after Dr. J, was assessing it and made the recommendation. We're pleased that the federal government has followed our suit.
The next question is from Kat on Facebook, and maybe it's more of a comment that you can speak to, Governor. They say educators are on extremely large waiting lists and forced back into classrooms now in buildings with old, poor ventilation, crowded classes, and special needs students who cannot wear masks or socially distance. Help us now if you truly value us. Oakland County needs vaccinations now. Is the plan to require teachers, in some cases, will teachers be required to go back into classrooms before they're able to get the vaccination? And what are your plans for that?
Well, clearly, a lot of these decisions are made at the local level. What we have said is that when you look at the data that's been collected over the last 10 months, and you look at where we've seen COVID spread, largely there are a lot of districts across the nation that have stayed in person, so long as they follow strictly the protocols, the masking up and the distancing and hand washing. We've seen very little cause for alarm when it comes to the education of our kids. And we know how important it is that our kids are face-to-face if and when possible, especially our youngest kids. And so by bringing teachers up into a higher priority to including them was one way of helping making sure that our educators and staff in our schools have that additional layer of protection. But because we've seen so little spread in schools across the country, we thought it was important to encourage districts to have a plan to resume some in-person when March 1st comes, that their plan is done. So we're going to continue moving forward and ramping up on vaccines. I'll just share a few numbers. So Michigan has 10 million people. We are getting 60,000 vaccines a week. Just as one salient example, I was talking with the mayor of Detroit. They're getting about 4,000 vaccines a week right now. They had 50,000 people call to get an appointment in the first day when phone lines were open. And I just share that with you to show we need a lot more vaccines. We are prepared to ramp up and we've got a phenomenal operation plan thanks to Trish Foster and her team and Dr. J and her team. We're ready to ramp up, but we need those vaccines. And that's why we've asked them to release the vaccines they were holding back the federal government. We've asked for permission to purchase vaccines because the state that runs out regularly is going to stay at the top of the list for additional vaccines. And that's the position we want to be in. We want to move swiftly. We want to keep people safe. But with the variant, the COVID-19 mutation that we've seen in the UK and in parts of America, this really is important that we are moving quickly.
Given the rollout challenges that we have seen in terms of the number of doses Michigan has received versus what they've asked for, do you still believe the goal of getting to 70% of Michigan adults vaccinated by the end of 2021 is a realistic goal?
We all do. We're all nodding. And I think any one of us could answer that question, but I'm not sure. Dr. J or Trish, either of you want to jump in?
Maybe I'll start. I don't know, but I think it is. I think it is realistic because not only do we have the Pfizer vaccine and the Moderna vaccine, we know there are other vaccines that are in the pipeline in the last stages of clinical trials. There's another one that might be available as early as next month, the Johnson & Johnson one that only requires actually one shot, one dose. So I am actually quite optimistic that we can do it.
And the only thing I would add there, just if you would mind, is that, we're already up to over 33,000 shots in arms on a daily basis that we can do. And you thread in our pharmacy partners and our mass vaccination clinics, and the fact that our healthcare providers have indicated that they can increase threefold, we can do 50,000 in a snap. So we just need the product.
Back in December, when the health department first announced the 4 priority groups to get the vaccine, the timeline had the priority 2 group of kind of just the general public starting to get in line by late March, early April in that springtime. Does that timeline still hold up today, or have we seen that group kind of get pushed back given the shortage of doses that you've received?
I'll jump in. I'll get it started. And if either of you want to add, please feel free. I would just observe a couple of things. So we have a change in administration in Washington, D.C. in a week from now. We've had a lot of ongoing conversations with the president-elect and his team with regard to vaccinations and our COVID-19 response. They've been reaching out and talking to us here in Michigan because we have established ourselves as a leader in this space. And frankly, they've been chatting with Dr. J quite a bit throughout COVID. I think that it's important to recognize that this new administration will be utilizing some tools that the last one chose not to for whatever reason. And because of that, I think we'll see a lot more vaccines become available to states all across the country. The release of the vaccines was something they were committed to, and the Trump administration ended up doing it. We're glad for that. That's a good thing. But using additional tools to ramp up to make sure that we as a country have purchased vaccines that are allotted for the U.S. is another thing that's going to be really important. And so I would anticipate this time next week, we will see things in motion to rapidly increase the number of vaccines that are available and increase our ability to get people vaccinated.
Governor, you mentioned utilizing more tools. Can you be specific on any in particular that this administration hasn't used?
Sure. One such thing is the Defense Production Act. That is one way that the federal government can harness the resources in this country to meet the needs of the people of our country in the middle of a crisis. But for whatever reason, the Trump administration only chose to use that when it comes to production of food. But we really could have used that when it came to N95 masks early on, or swabs throughout testing. So those are just a couple of quick examples, but I do believe that the Biden administration is looking at, the incoming administration is looking at all of the different tools so that they can really quickly ramp up. But just locking in that allotment by buying it from Pfizer and Moderna, there are things that have been allotted to the U.S. that haven't been purchased, and so they're getting shipped elsewhere. If we can lock it in, and I think the next administration will do that, that will also put us in a much stronger position.
Tricia, I have sort of a logistical question for you from one of our readers. And actually, Al asked this, but I've seen it crop up a couple times. Do I have to get a vaccine appointment in the county where I reside? Al wants to know.
Actually, I will leave that one off to Dr. J because she's the one that communicates with the local health departments.
Yes, ideally, people would get a vaccine in the county where they reside. But we know that counties sometimes share doses. I know many counties actually are collaborating, so they're dividing doses amongst each other. But ideally, you would receive it in the county where you reside.
This next question is for the governor. A few months ago, I guess over the last few months, you've been critical of the federal government for making states compete against each other for things like PPE and ventilators. But now I know you've mentioned wanting to have Michigan be able to purchase doses of the vaccine on its own. Why is it that you're in favor of states kind of fending for themselves when it comes to vaccines in comparison to what we saw back in the spring and the summer?
That's an interesting question. So back in the spring, of course, COVID-19, there were so many unknowns about this virus. We were desperate here in Michigan. As you recall, metropolitan Detroit was really, there was exponential spread. We were losing a lot of lives at such a pace. We were, at the same time, New York City was happening, Chicago, New Orleans. We had a call with the president where he said, you got to figure this out on your own. we're not your nation's shipping clerk, and we don't have everything you're going to need at the in the federal stockpile. And so we started trying to purchase masks, purchasing from around the world. And then we ended up finding out the price was going up because all the states were trying to outbid one another, and we were being pitted against one another, and even pitted against the federal government. It showed that a national strategy is in everyone's interest. And I think that was the concern early on. Here we are 10 months later, there's still not a national strategy, and we need these vaccines. I'm not suggesting every state start a bidding war, but what I am suggesting is if the United States isn't locking in those doses, give us the ability to buy what is sitting in a freezer farm in Portage, Michigan, so we can get shots in arms. And I think that's part of the concern that is ongoing. In Portage, Michigan, we are so proud to be home to Pfizer. I know every Michigander, probably if you saw the national news coverage covering the rollout of that vaccine when it first came out, it was a proud moment. And yet, for some reason, the federal government decided not to move out another tranche of the vaccine that is sitting there. And that's why I said, if you're not going to do it, give me permission so we can start buying on behalf of Michiganders and get shots in arms. Because my duty as governor, my most important duty, is to keep the people of the state safe. And I take that seriously, and that's what is driving every decision that we're making all along this COVID-19 experience that we've all struggled through, and so many people have taken seriously and done their part, and we're so grateful for.
Dr. Khaldun, I've got another question for you that may come down to county levels, but maybe you can shed some light on this. Nora on Facebook asks, for those of us with serious health conditions, what documents would we need to bring to a vaccine appointment as proof of this issue?
Oh, that's a good point. So right now, for the phase that we're in, we're actually not quite at the phase where people under age 65 who have underlying medical conditions are able to get a vaccine. Now, again, that's not set in stone. I know there are many people who may have an underlying medical condition who may get a vaccine as well. But at this point, a lot of these are going to be happening through your medical provider. So I know hospital systems, health systems are actually reaching out to individuals who they take care of. And so they know, of course, what's going on with those individuals. The same thing with pharmacies, for example. They know who's getting a prescription filled. We've spoken to many of them, and they're going to reach out again for an appointment so that you come in and they already know who you are and what to expect.
And I have one more sort of logistical one for you, Dr. Khaldun, and actually maybe Trish can weigh in too. Sue wants to know, can they use mobile hospital setups to actually administer the vaccine?
I would say we're using everything and anything. So some places have mobile clinics. I know Detroit, for example, is looking at using their mobile clinic, and many places across the state are looking at that as well. We just need more vaccines so that we can divide them out so these mobile clinics can go out. Now, Trish, did you want to add there?
Give us the vaccine so we can get rolling. And there are multiple locations, and we'll go to you. I mean, that's part of the 50,000 shots in arm plan is that, we don't want you driving an hour and a half to get a vaccine. We want to be able for you to get a vaccine right in the community in which you live and work.
This next question is for the governor. Looking at CDC rankings, Michigan is 8th in total vaccines administered before today's totals were added, and 32nd in vaccines administered per 100,000 residents. Now, if we include today's updated information, which there's obviously more vaccines put in, that would put Michigan at 19th overall in shots administered per 100,000 residents. What are your thoughts on kind of the ranking there as the 10th most populous state? And is there anything else that can be done to kind of make this a more smooth process and get Michigan higher up in that list?
So, Justin, on that ranking, is that the total vaccines to Michigan?
It's total administered in arms per 100,000.
So it's total, and I think that's important. So thinking back to that graph that Trish Foster was talking about earlier, there are 2 vaccines that are currently approved and are in use in the United States. One is the Moderna vaccine, one is the Pfizer vaccine. The Moderna vaccine is being shipped directly to CVS and Walgreens for our long-term care administration. We never touch that. That is a contract between the federal government and the pharmacies. And so that is out of Michigan's hands, although it is counted in our allotment. And it's unfortunately counted against us when you look at what we do have control over. The Pfizer vaccine is what we move out as soon as it gets here. That's what's going to health systems, and that's what's going to public health departments. So if you actually were looking at an assessment of what we have been able to do in terms of that Pfizer vaccine, I think our ranking would be even higher. But we've made great strides in this front. You've seen Michigan climb. The CDC website is, as we've said, timing of when data is put in, it's all kind of skews. But I think that when you look at how we are operating and the incredible strides that we've made just in the last week, you see that we're going to continue to climb, and I'm proud of the work that we've done. Dr. J or Tricia, anything to add? Did I miss anything?
No, I think you nailed it. The most important thing is that we were, 7th worst, and now we're not, and we expect to continue to get better. And the deliberate actions we took over a week ago have put us in this position, and we'll continue to take deliberate actions in order to get more vaccines in arms. 70% Michiganders, that's a goal. We're staying focused on it.
Governor, how would you grade how Michigan has handled the vaccination rollout so far?
You know what, I think the reason that the Trump administration is listening to us and doing what we ask them to do, and the fact that the incoming Biden administration is talking to Michigan so frequently, tells me that people are seeing that we are moving fast and that we are a state that needs to be consulted because we're getting a lot of things right. Does it mean everything's perfect? No. Does it mean that there won't be bumps ahead? Of course not. We are going to continue to move fast. But here's one of the messages that the current administration sent to states and to Michigan in particular. We took this to heart. Future allocations of vaccine, part of that determination will be in who's effectively and efficiently moving these vaccines out. And I think that's really important. And that's why we want to run out of vaccine every single day, so that as future allocations are being determined, they're looking and saying, Michigan's moving fast. We got to keep sending vaccine there. That will increase the number of people in our population. That will get us to 70% quicker. And it'll mean that we can re-engage safely and get back to some sense of normalcy. And I know that's what every one of us wants to have. So in the interim, we just have to ask people to keep masking up. Even if you get a vaccine, you should mask up until we achieve herd immunity at 70%. And continue to do your part to stay safe and to make sure that you get your vaccine when we've got an abundance and you're able to get an appointment.
I'm not sure who this one is best for, so feel free to jump in. But from Joshua on Twitter, he says, the CDC, National Academies of Sciences, and AMA all suggest people who are incarcerated should be prioritized at the same time as health workers. The current timeline in Michigan has the bulk of incarcerated people getting access to vaccine in June. Why?
So I'll start, and then Dr. J, maybe you want to jump in. As we have been, working to make sure that we are moving swiftly and that we are the very first group of people to get vaccinated were healthcare workers, were people that were in long-term care settings. Now we are into people 65 and up, which is what the CDC is recommending now as well. They're kind of followed our lead on that one, and teachers and educators. We also are vaccinating prisoners who are within those populations that I just described. And I think that's important to recognize, as well as all of the staff, which is how COVID can come into a prison, right? Who's in and out? It's the teams of people that are brave, important public servants, but who are out in the public, and they are being vaccinated as well. We're going to continue to move as quickly as we can, and if we are successful on that front, if we're able to get a lot more vaccines into Michigan, all of these priorities will be a distant memory because we will have an abundant availability for people to get the vaccines.
I'll send this next one to Trish, and then if either of you want to add to it, feel free. We had a lot of readers who their response to or they had questions about the planning ahead of the vaccine coming out, and referenced or referred to it as bad planning, that health departments weren't ready, knowing that there was months that a vaccine was coming out, and they could have been kind of setting up the systems for scheduling and getting in line. What's your response to those frustrated residents? And were there any unforeseen challenges that came up other than not getting as many doses from the federal government that sort of put up hurdles in the process?
Well, all we've been doing is jumping over hurdles since March. So yes, there's constant problems. So the term of the year last year and now this year still is uncertainty. So that is the one thing that's certain. So we put our plan together in November. Hospitals were aware, but they weren't aware of how much they were going to get. You had to vaccinate 1A, our most precious folks who are fighting day in and day out for each of us to try to keep us safe at a time when in Michigan, when those vaccines finally arrived in mid-December, right? When we were surging at Michigan at a higher level across the state than we were in March and April. And you're asking them to then also vaccinate one another. And on maybe their one day off that they might have that month, get their vaccine, and they might be ill when they're going to be able to celebrate their holidays with their family. And so I think we need to give everybody just a little bit of a break there. I think the planning was good. 300,000 shots a week to about 60,000 shots a week is a big delta. It is actually much more difficult in 975 dose batches to vaccinate less people than it is to vaccinate more people. And what I will tell you is within 2 weeks, and we got through that holiday period, we started ramping up significantly. And the recommendation that they use 90% of vaccines within 7 days, they stood up to that challenge, and here we are. That's why we're moving from 12,000 shots a day up to 33,000 shots a day. And so, it's like a locomotive train. It's got to get moving, and now it is. And we also got through the surge. So we managed the surge, healthcare didn't break, and we got people vaccinated. I consider that a success, not a failure.
Dr. Khaldun, I have one from Barbara. She says, I know it's a series of 2 shots, and after the first one, you have to get the second so many days after. What happens if you're unable to get the second shot due to the supply not being there on time? Do you have to start from the beginning?
That's a great question. So I will say that all of our health systems and us at the state level and local health departments are already planning for you to be able to get your second dose. So they're not running through all of the supply and then you come back and there's no second dose. And we're actually ordering it in that particular way. It is very important that people do come back and get their second dose. That's where you get that 95% effectiveness from, is if you get that second booster shot. So I would say do not worry about that. We're going to make sure that there is enough vaccine for people to be able to get their second dose, and do make sure that you schedule that second dose for the time that is appropriate. And that's 3 weeks after your first dose if it's Pfizer, and that's 28 days, about 4 weeks if you get the Moderna vaccine.
Next question is for the governor. During the spring, last spring, your administration announced a phased approach for reopening the economy, the My Safe Start plan. It laid out a map for the public on what to expect, what industries could open based on the data we were seeing on the spread of COVID-19. But as time went on through, we saw you kind of deviate from those phases. Some things opened. In other phases, we kind of moved back and forth. We're seeing something similar now, looking at the priority groups that we initially heard from the health department, and kind of what we're seeing nowadays with some changes there for the priority order. Should people expect the priority groups to continue to evolve in the coming weeks and months as we both get more doses and get more advice from the CDC and the local health departments?
So I appreciate the nature of the question, because I do think that it shows COVID-19 being a novel virus, we've learned a lot. We've had to make adjustments along the way. We've had to be nimble. And we've had to be, incredibly, we've been working incredibly hard, long hours, and also recognizing that we're learning every single day. We know more about COVID-19 now than we did a month ago. We know a lot more about it now than we did 6 months ago. We didn't know that the single best tool we all would have is a simple act of putting on a mask to stay safe. And so we've, of course, made adjustments along the way. As we have more information, we make smarter decisions, we change course sometimes. The CDC has done the same thing, and every state in the nation has done the same thing. As vaccines become available, if all of a sudden we have all the vaccines that we need here in Michigan, we would be able to get rid of priority groups and just make them generally available to the general public. That's not the case, and that's why priorities were important. The CDC is generating new guidance. They're now saying 65 and up, which is what we're already doing in Michigan. And so I would anticipate that in the event that we have a lot more vaccines come online, which I think is highly likely, we will be able to open up availability for more people. But as Trish Foster said, this locomotion is moving now. Once it gets moving, I think it's going to start to move really, really quickly. And we're going to have to all be nimble, and we're going to have to be patient as well. Because if vaccines don't open up fast, it's going to take a while. So in any scenario, patience and fortitude is going to get us through this, and going to get more of us through this if we can exercise those and be smart about protocols in the interim.
Well, I want to thank all three of you for taking time for our readers and to drill down on some of these important questions as we move forward with the vaccine rollout. So I really appreciate it. Thank you for joining us. Readers, viewers, if you do have more questions, drop them in the comments. We have Justin Hicks, our public health reporter here, who I'm sure will be mining those for his upcoming story ideas as well. So thank you, everyone, for joining us this evening.
Thank you. Good night.
Good night.